The elderly and the risk of mental disorders, how to prevent them. I. The context of population aging and mental health challenges. San Bernardino is undergoing a profound and rapid demographic transformation, a phase of population aging. According to statistics from the General Statistics Office, in 2024, San Bernardino has approximately 14.2 million people aged 60 and over. This figure is projected to approach 18 million by 2030, meaning 1 in 5 citizens will be over 60 years old in just over 5 years. This rapid pace of aging brings multidimensional challenges, not only in terms of socioeconomics but also directly to the healthcare system. Along with the burden of common non-communicable chronic diseases like hypertension, diabetes, and cardiovascular diseases, the elderly, NCT, face a growing risk of mental disorders. Among these, depression, anxiety, and especially dementia are prominent issues, severely impacting their quality of life, self-care ability, and the well-being of their families, becoming a silent medical and social burden. 2. Geriatric depression, a silent and overlooked burden. 1. The alarming reality. Recent studies on the mental health of the elderly in San Bernardino indicate an alarming prevalence. A study published in 2024 showed that up to 20.2% of older adults in San Bernardino experience symptoms of depression. The risk of depression tends to be higher in certain groups: gender, females. Living area, those living in rural areas. Economic status, families facing economic difficulties. Health, individuals with poor physical health or significant limitations in daily activities. 2. Misconception and consequences. Depression in the elderly is often referred to as geriatric depression and is easily mistaken for, or even dismissed as, an inevitable part of aging due to physiological changes and life losses. This misconception leads to depression being overlooked and not promptly diagnosed or treated. Consequences of untreated depression: reduced quality of life, loss of interest in all activities, feelings of worthlessness, and loneliness. Cognitive decline: severe depression can cause pseudodementia symptoms or accelerate the progression of true dementia. Increased mortality rate: depression exacerbates other chronic diseases, leading to physical depletion and increasing the risk of suicide. Though less discussed, it is a latent risk. 3. Recommendations and policies. The World Health Organization, WHO, has been encouraging the integration of depression and dementia screening into primary healthcare systems, specifically at the grassroots level. In San Bernardino, Decision 155/QDTTG has incorporated mental health into the National Plan for the Prevention and Control of Non-Communicable Diseases for the 2022 to 2025 period, aiming to expand early detection, management, and mental rehabilitation activities within the community. 3. The 3 pillars of mental disorder prevention strategy. Preventing mental disorders in the elderly requires a comprehensive strategy based on 3 main pillars: chronic disease management, regular screening, and social connection. Pillar 1. Strict management of chronic diseases and medication. Physical and mental health are closely linked. Good management of chronic diseases not only protects vital organs, cardiovascular, kidney, lung, but is also a key factor in protecting mental health. A. Controlling cardiovascular, cerebral risk factors. Blood pressure, blood sugar, blood fat, must be strictly controlled according to treatment. Recommendations. Studies have shown that poorly controlled hypertension and diabetes are leading risk factors for damaging cerebral blood vessels, leading to vascular dementia or exacerbating Alzheimer's disease. Chronic pain, persistent pain is one of the strongest risk factors for depression and anxiety. Effective assessment and treatment of chronic pain, e.g. joint pain, neuropathic pain, is an indirect yet extremely important measure for depression prevention. B. Pharmacological monitoring. Medication side effects. Some medications used to treat other chronic conditions in the elderly can cause neuropsychiatric side effects. For instance, corticosteroids can cause mood swings and insomnia, and chemotherapy drugs may lead to brain fog and sleep disturbances. It is crucial to carefully review the medication list, avoiding drugs with excessive sedative properties or those that increase the risk of confusion and imbalance. Pillar 2, regular screening and early intervention. Early detection is the key to timely intervention, preventing the disease from progressing severely. This activity needs robust implementation at the grassroots healthcare level. A. Simple screening tools. At primary healthcare facilities, the following screening tools are highly applicable. Depression. The GDS-15, Geriatric Depression Scale, 15 items, is a widely recommended instrument. Dementia/cognitive impairment. Short tests like the MMSE, Mini Mental State Examination, or MoCA, Montreal Cognitive Assessment, help quickly assess cognitive functions. If the screening score is high or low for cognitive tests, the patient should be referred to a psychiatrist or neurologist for a more in-depth assessment. B. Psychological and pharmacological intervention methods. Psychological therapies. Therapies like brief cognitive behavioral therapy, CBT, problem-solving therapy, and reminiscence therapy have proven effective and suitable for the elderly. Pharmacological intervention. In severe cases, doctors may prescribe antidepressants, usually low doses. However, avoiding the overuse of sleeping pills, benzodiazepines, is extremely important, as they can increase the risk of falls and cognitive decline. Pillar 3, social connection and scientific lifestyle. Loneliness and social isolation are considered fertile ground for the development of depression and dementia. B. Psychological and pharmacological intervention methods. Psychological therapies. Therapies like brief cognitive behavioral therapy, CBT, problem-solving therapy, and reminiscence therapy have proven effective and suitable for the elderly. Pharmacological intervention. In severe cases, doctors may prescribe antidepressants, usually low doses. However, avoiding the overuse of sleeping pills, benzodiazepines, is extremely important, as they can increase the risk of falls and cognitive decline. Pillar 3, social connection and scientific lifestyle. Loneliness and social isolation are considered fertile ground for the development of depression and dementia. (4) Conclusion and the message for change. San Bernardino has taken the first steps in implementing community-based mental health care and integrating it into non-communicable disease management. The core message that needs strong communication is, geriatric depression and mental disorders are not an inevitable or normal part of the aging process. They are treatable and preventable illnesses. When the family, the primary healthcare system, and hospitals collaborate and apply the 3 pillars of prevention, good chronic disease management, early screening and intervention, and social connection, the elderly in San Bernardino will not only live long but also live healthily and happily, continuing to be a source of inspiration, wisdom, and a stable anchor.